In Jamaica, Health Minister Dr. Fenton Ferguson maintains that the island continues to fare well compared to other countries in the region with higher mortality rates among neonatals, and that the current outbreak of bacterial infections among newborns at two major hospitals is normal. Speaking in Parliament on Tuesday, the Health Minister says since the outbreak, 483 babies were admitted to the special care nurseries at the University Hospital of the West Indies and the Cornwall Regional Hospital. Of that number, 45 were infected with either the Serratia or Klebsiella viruses. 19 babies have died from their infections, with another baby having died at the Cornwall Regional Hospital since news broke a week and a half ago. The Health Minister used his Parliament platform to commend the work of the healthcare workers in controlling the spread and outlined the actions taken.
When there's an infection in a hospital, the hospital local infection control team takes charge of the process to control the infection. The local parish health department and the surveillance unit in the Ministry of Health are notified through the ministry's surveillance system. When the Ministry of Health is informed about an outbreak, several strategies are recommended to the health facilities under the ministry's guidance to handle the onset of the infection involved. They are, Mr. Speaker, enhanced surveillance and monitoring of the outbreak with daily reporting to the MOH, isolation of infected babies and placement in separate rooms, new admissions placed in a different location, increased infection control measures such as increased frequency of cleaning, deep cleaning, monitoring of hand washing, and consistent use of personal protective equipment, additional equipment and supply purchased, staffing levels enhanced by redeployment and engagement of additional sessional staff, training, retraining and orientation of staff, parents and guardians.
Meanwhile, opposition Member of Parliament Daryl Vaz asked the minister to confirm whether there is another infection affecting children at local hospitals.
The Bustamante Hospital for Children was recently affected by an outbreak of what is known in medical circles as the MRSA infection. Is that outbreak ongoing? Yes or no?
To which the minister responded,
what I can say to you, member, that all our hospitals that have special care units from time to time are impacted by infections. I said that in my presentation. It would not be for me to come here today with you asking about a specific infection in the way you have and expect me to say to you yes or no. Yeah. And we will investigate and get back to you.
And despite growing calls for him to step aside, Health Minister Dr. Fenton Ferguson remains resolute that he's not going anywhere. And his supporters are backing him all the way. A number of supporters from Dr. Ferguson's East St. Thomas constituency turned up at Parliament on Tuesday to give their embattled Member of Parliament support. They say calls for Dr. Ferguson to step down are unwarranted. They believe Dr. Ferguson acted promptly when he was made aware of the infant deaths.
I am supporting Dr. Ferguson because he's the #1 minister.
So we're backing him because most of what is happening, they're blaming him and it's not his fault. Information comes to him and I know the minister that we have. He's the best health minister that we have this country have ever seen, and I know he's a good man at heart and he will do anything in his power to save lives.
The fundamental truth is that it must be the persons who are accountable for the hospital, the accountable officers, that are to be held responsible for that situation. The fact of the matter is, based on my understanding and follow-up of the news, is that they also informed the minister late. And upon informing the minister triggered his mechanism his reaction mechanism to immediately put programs in place to stem any further deaths. So it is difficult for me as a CEEN citizen to agree with anyone that says that the minister should resign.
He wasn't informed about the death of the babies until Friday while he was in a retreat in Ocho Rios. So that's no fault of his. Secondly, those babies are premature. Only the hands of God could have saved them.